When we talk about lung tumors, one tiny little word can change everything. Is the tumor in the lung or is it on the lung? It might sound like splitting hairs, but it's a huge distinction. So in this explainer, we're going to dive into the work of pathologist Dr. Vijay Shankar and break down exactly what that difference means. Let's get right into it. So right off the bat, this is the big question. A tumor in the lung versus one that grows on it. It seems simple, right? But in the world of pathology, the answer to this is absolutely fundamental. So just keep this question in the back of your mind as we go. Okay, first things first, let's get the lay of the land. Our lungs are incredibly complex, and as our source material points out, they can be home to all sorts of different tumors. Some are benign, meaning not cancerous, while others are malignant. It's a really broad field, so for our purposes, we're going to focus on two of the major players. And that brings us to the most common culprit of them all, bronchogenic carcinoma. Seriously, if you've ever heard about lung cancer, this is probably what people were talking about. This is the main type of tumor that actually starts inside the lung tissue itself. So what's really going on here? Well, this tumor originates in what's called the respiratory epithelium. Just think of that as the delicate inner lining of all our airways. It's like the wallpaper inside every single branch of our lungs, from the big ones, the bronchi, all the way down to those teeny tiny air sacs, the alveoli. This is ground zero. This is where bronchogenic carcinoma gets its start. Now, to really get a handle on a tumor like this, a pathologist can't just take a quick peek. Oh no, they have to conduct a super detailed investigation. So let's look at the 4 key things they examine to build a complete profile of the disease. Think of this 4-part investigation like a detective's case file, really. First up is etiopathogenesis. That's the why. What caused it? With lung cancer, smoking is obviously a major factor. Next, classification. What's the specific type? Is it a small cell or a non-small cell carcinoma? Then you've got morphology. What does it actually look like under a microscope? Are the cells big, small, a total mess? And finally, clinical features. How is this actually affecting the patient? Are they coughing, losing weight? Every single piece is a critical clue that helps figure out the best way to move forward. All right, so we've talked about the big one that's inside the lung. Now let's completely switch gears and talk about a totally different but just as important tumor that's found on the lung, mesothelioma. This is a whole different ballgame. And here it is, the key difference. Mesothelioma doesn't start inside the lung at all. It actually grows from the pleura. That's that thin protective sac that wraps around the outside of the lungs, kind of like the plastic wrap around a sandwich, right? This is why it's a tumor on the lung. And here's another thing. While smoking is the huge driver for tumors in the lung, the vast majority of these pleural tumors are linked to asbestos exposure. And boom, this slide just lays it all out perfectly. On the left, you've got bronchogenic carcinoma. It's born from the inner lining of the airways, so its location is inside the lung. Then on the right, mesothelioma. It comes from that outer protective wrapper, so its location is on the lung surface. We're talking 2 completely different origins, 2 different locations, which of course means they need different diagnoses and different treatments. So why do we have to get this specific? I mean, why does all this detail matter so much? Because this level of precision, this is the very heart of pathology. It isn't just about giving diseases a name. It's about understanding them from the ground up to guide treatment and push research forward. It's really both a science and an art. And that whole idea of art is just the perfect way to look at it. The author of our source material, Dr. Vijay Shankar, is described as having developed the art of content generation. And that's exactly what a good pathologist does, right? They don't just see a bunch of cells on a slide. They see patterns, they interpret them, and they tell a story, the story of a disease. And telling that story is the very first step to helping a patient change the ending. So that leaves us with this final thought to chew on. We've just seen how pathology gives us this incredibly precise map of what's happening inside our bodies. The question then becomes, how can we use this art, this incredibly deep and detailed knowledge, to not only treat the diseases we have today, but to build a future where we can get way better at preventing them tomorrow?